Hi, my name is Alexis Benhagen, and I'll be doing my case study on mononucleosis. So this is my concept map, and first we're going to talk about the statistics, and then we'll talk about why it occurs, the client information, the signs and symptoms, the diagnosis, and the treatment. So the statistics are: mononucleosis is an infectious and highly contagious viral disease that is caused by Epstein-Barr virus, and also known as EBV. It is found throughout the world and gets to more than 75% of people before adulthood. EBV is worse for adults rather than children only because the symptoms last longer with adults. The virus affects children about 2 weeks after they are infected, whereas adults can wait anywhere between 1 and 2 months to feel the infection. So, why it occurs. This disease is spread with saliva, blood, and semen, so basically through body secretions. The epithelial cells are the first to be affected by the virus within the nasopharynx, so the nose. And the T lymphocytes are very important to moderate the symptoms. And this picture is basically just talking about what does what and gives you a visual. So next we're going to talk about the client information, which she did tell me that I could use. So I did ask her a few questions, and she was kind enough to record them with me. So, how old are you now, and when were you diagnosed?
I am 20 years old, and I was diagnosed 3 years ago as a junior in high school.
Oh, wow. Okay. So, what were some of your symptoms that you experienced, and what was the worst one?
My symptoms were fatigue, nausea, body aches, sore throat, loss of appetite, swollen spleen, red discoloration in my face, swollen eyes, and also swollen lymph nodes. The worst symptoms were definitely fatigue and body aches for sure.
Oh, wow. Okay, that does not seem like a good time. All right, so if you don't mind me asking, how did you get mononucleosis?
I believe I got it from sharing drinks with my teammates. I will never do that again. Some people thought it was from kissing others because it's known as the kissing disease, but what they didn't know is that I hadn't kissed anyone in over 6 months.
6 months, wow. All right, so thank you for helping. The signs and symptoms, we talked about it briefly on the previous page, but I wanted to just compare the common symptoms with my client's symptoms. So the common symptoms are fatigue, body aches, sore throat, swollen lymph nodes, nausea, rash, fever, and enlarged spleen or liver. And AM symptoms were fatigue, nausea, body aches, sore throat, loss of appetite, enlarged spleen, red discoloration of the face, swollen eyelids, and swollen lymph nodes. Next, we're going to talk about the diagnosis, which was really hard to come by. So the first time she went to the doctor, they told her it was strep or pneumonia, and they thought her asthma was just acting up. Granted, her symptoms were not as severe. She only experienced fatigue and body aches at this point. So she went again within the week, and they told her it was the flu and to take Dayquil, NyQuil, and it should go away. She went again the following week, and her symptoms worsened. This is when they finally diagnosed her with mononucleosis. So having this disease and not knowing that you have it is really dangerous when the symptoms don't show up right away. Next, we're going to talk about the treatment. So in the first 3 weeks, AM did not know exactly what she had, so she took ibuprofen the first week and NyQuil and Dayquil the next 2 weeks following. She drank liquids and tried to rest. After diagnosing her, they told her to do the following: to use a nebulizer, rest, take ibuprofen, and stop any extracurriculars. This is just to get rid of the symptoms. However, she will have mononucleosis forever. And these are my references. Thank you for watching my case study presentation, and I hope you have a great day.